So one of the most questions I get is how to take care of scars to make them heal beautifully. So whether that's a laceration from a cut or even a post-surgical scar, here's kind of my global way to take care of scars so that you can't see them afterwards. First of all, anytime you get a cut, even if it's a paper cut, unless you're a neonate or baby, you will have a scar. So the question is, how do you make it so it heals well so that people can't see it? So the global, most important thing, keep it out of the sun. Do not let sun touch it. Sun will darken or hyperpigment scars. In the first 5 to 7 days, what you want to do is keep it clean, obviously, and don't use hydrogen peroxide, by the way. That kind of is inflammatory. So you just want to keep it clean with saline, maybe some hypochlorous diluted solution, something like that. Then keep it moist, and that's with an antibiotic ointment. I recommend either bacitracin or mupirocin, which is a prescription. Don't use Neosporin. Neosporin has a high risk of causing an allergic response, and you can see that it gets red and causes some yellow weeping and things like that. So don't use Neosporin. So first, basically week, use the antibiotic ointment. After about a week, and if you have stitches in around this time, stitches are going to start coming out if it's on your face, use Aquaphor or Vaseline. Doesn't matter. Sometimes people get a reaction to one or the other, but the whole idea is to keep the incision moist. So about 2 weeks later, stitches are out. You've been doing Aquaphor Vaseline. You're keeping it out of the sun. Now you switch to a scar treatment product. So my favorite, is usually a silicone gel. You don't have to do anything expensive, but it's a silicone-based scar treatment. Silicone-based cream or gel. Scaraway is a popular brand that's affordable. Siligel, all these different ones. Or you can even use, by the way, you can use silicone pads, and that's what this is right here on my nose. So these silicone pads, and I'm using it for hyperpigmentation here, and also a little thing I had here on my nose. That does two things. When you get these brown ones, it keeps it out of the sun. So I still recommend putting sunscreen on, let it dry, and then put the silicone pad on. But it helps keep it out of the sun if the sunscreen wears away. But two, the silicone keeps the area moist and accelerates healing. If you do a good job taking care of scars, you shouldn't be able to see them long term, unless you have a history of bad scars like hyperpigmentation, keloids, hypertrophic scars. So on my face, this whole time I've been talking, I had a big scar at my eyebrow. It's right here. I got it in basketball right before my MCAT, actually. Elbow to the face. It's pretty invisible. I mean, even zooming in with this camera, you can kind of see it right there. I did these pads for 6 months. So kept it out of the sun, kept the silicone on it, healed beautifully. So the first thing is obviously, if it's a big incision, getting it closed appropriately, if it's on your face, a facial plastic surgeon, someone with a high degree of detail, putting the stitches in. People often ask, are absorbable stitches or non-absorbable stitches? The answer is non-absorbable stitches are my preference, something like a nylon or even a Prolene, because those stitches don't stay in. Things that stay in the body that are foreign bodies, which is basically an absorbable stitch, those can be more inflammatory to the incision line, so I prefer that you don't do that. And then long term, if your incisions are not healing as fast as you want, or your stitches are not healing as fast as you want, you can think of doing lasers, CO2 laser, things like that, which will help the pigment and texture of a scar. But overall, the summary: sunscreen, let's keep it out of the sun. First week, do antibiotic ointment, then switch to Vaseline or Aquaphor to keep it moist, and then silicone cream. 1, 2, 3, 4 basic steps to make your scars heal beautifully. All right, hope that helps.